Acute conjunctivitis. In this photograph, note the redness of the conjunctiva. This patient has watering, photophobia and foreign body sensation in the eyes. This is acute conjunctivitis. Often it comes as an epidemic. Give antibiotic drops to be put in both the eyes every 2 to 4 hours and hygienic instructions to prevent the infection of other people in the house. If the eye is chronically red, chronic conjunctivitis, then evert the eyelid and inspect the inner surface for follicles. If small translucent follicles are seen, refer the patient to an ophthalmologist for treatment of trachoma. Trachoma needs long-term treatment with acromycin ointment twice daily for 2 to 3 months. Watch the tiny translucent follicles of trachoma. Stye is an acute tiny abscess due to infection of the hair follicle of eyelashes. Give an antibiotic eye ointment and oral course of antibiotic along with anti-inflammatory drugs and hot fomentations. It will always subside. If pus is pointing, then gently pull out the hair coming out of it and the pus will drain away. But if the styes recur frequently, then you should investigate the patient for diabetes or a refractive error. Note the stye on the upper eyelid at the lateral end. Note the white ring along the border of the cornea. This is termed as arcus senilis and is an aging process. It has no clinical significance and does not affect vision. Its peculiarity is that there is a clear zone of transparent cornea outside the opaque ring that is between the arcus and the limbus. Note the white opacity in the cornea. It usually occurs after a deep corneal ulcer, foreign body or injury to cornea. If it obstructs the vision, then a corneal graft from a donated eye will be required to restore the clarity of vision. The opacity may be dense white as seen in the lower part or translucent as seen in the upper part in this case. Here the opacity is in the center behind the pupil. You can see the shadow of the pupil on the lens. This is an opaque lens or cataract. Refer the patient to an ophthalmic surgeon for cataract surgery. The shadow of the iris indicates that this is a mature cataract. Note the shadow on the lens casted by the iris.